This is an informative video to explain the NHS low-calorie diet programme, sometimes known as the Shakes and Soup diet. The service is provided by ABL Health for people living in Nottinghamshire and Nottingham County. ABL Health work in partnership with NHS Nottingham and Nottinghamshire. The aim of this video is to provide you with information about the programme so that you can make an informed decision if it is right for you. This programme is an innovative and structured 12-month programme. It is aimed at people who are overweight and have been diagnosed with type 2 diabetes within the last 6 years. During the programme, you will be provided with a low-calorie diet treatment with the aim to achieve rapid weight loss of around 15 kilograms or just over 2 stone. There is strong evidence to suggest that this amount of weight loss, when it is achieved in a safe and supportive way, can achieve remission of diabetes. We will discuss the remission of diabetes in more detail over the next slides. By improving your diabetes control, you can reduce all the risks associated with type 2 diabetes and may even stop or reduce the diabetes-related medications you need. Please note that it is important to follow the programme and not attempt this amount of weight loss on your own without professional input. Rapid weight loss is not advised if you are a healthy weight, under 18, pregnant, breastfeeding, or have ever been diagnosed with an eating disorder. The low-calorie diet programme is based on trials called the direct and droplet trial. These trials have been running for a long time and have been showing very promising results. For instance, for those taking part in the direct trial, 46% managed to put their type 2 diabetes into remission, and 2 years after the trial, 36% of people were still in remission. To take part in the programme, you must meet the minimum criteria. You must be between the ages of 18 and 65, have been diagnosed with type 2 diabetes within the last 6 years, and your BMI must be over 27 for people from a white ethnic group, and over 25 for those from a Black, Asian, or other ethnic group. However, there are other considerations too, such as your general health or the medication you are taking. Your healthcare provider can give you more information on your individual circumstances. The programme lasts for a year and is completely free of charge to you. This includes free meal replacements and fibre supplements during the first 12 weeks, and one-to-one support with a specialist nutritionist throughout the programme. During your appointments, the nutritionist will weigh you and take your blood sugar levels and blood pressure readings. This is important as the medication for your diabetes and blood pressure may have changed before you started. Changes to your medication can only be made by your GP, and we will keep in touch with your GP throughout the programme. The nutritionist will provide you with knowledge and skills to get the best out of the programme. Some of the topics are included on the slide and cover things like energy balance, routines, habits, goal setting, and many more. They will also guide and motivate you and provide you with lots of tools and information on how to move through the different phases of the programme and how to overcome the obstacles you may experience along the way. It is important to understand that by joining the low-calorie diet programme, you are committing to a year-long intervention, so the timing has to be right for you. So if this is not the right time, then maybe you will be in a better position in a few months' time to join then. In the next few slides, we will just recap on type 2 diabetes. Diabetes UK is a well-known website and has a lot more information you may wish to look at. Type 2 diabetes is a serious condition and can be lifelong. Type 2 diabetes is where the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. This means your blood glucose or blood sugar levels keep rising. High blood glucose levels cause damage to parts of your body, including your eyes, heart, and feet. However, with the right treatment and care, and a willingness to address diet and activity levels, people can still live well with type 2 diabetes and lower their risk of complications. Statistics tell us that about 90% of people in the UK are overweight. Type 2 diabetes is often linked to being inactive, a family history of type 2 diabetes, getting older, or if you have high blood pressure, if you are of South Asian, African Caribbean, or Black African descent. Healthier eating, being more active, losing weight, and taking medication can be very good treatments for type 2 diabetes. By making positive changes in the way you eat, achieving a healthier weight, and taking your medication daily, you can live well with type 2 diabetes and reduce your risk of developing complications. The NHS low-calorie diet programme is where research meets real life. The programme has shown to be a great alternative option for the right people at the right time to manage their type 2 diabetes. However, you need all the information and facts. Make sure you can take part in the programme, as it is not for everyone, and you need to be very motivated and committed to begin. Remission in people with type 2 diabetes means that your blood sugar levels are no longer high and have dropped to normal levels without you needing to take any diabetes medication. Some people call this reversing type 2 diabetes, but we prefer the term remission because your type 2 diabetes can come back, especially if there is a return to old habits, or you gain weight, or you simply get older. Therefore, it is very important that you have all your yearly diabetes checks at your GP practice, regardless of achieving remission. There is no guarantee you will reach remission, as the research so far suggests that it isn't possible for everyone. However, there are many other benefits to joining the programme and losing weight. Research tells us that remission is most likely to be achieved if you have not had diabetes for very long, and you achieve a good amount of weight loss. We know that a modest 5% weight loss can help your blood pressure control and decrease your cholesterol levels. Is remission a cure for type 2 diabetes? In short, no. Diabetes remission is quite a new idea. A lot of research is needed before we fully understand it. We don't have enough evidence that remission is permanent. It needs to be maintained, and in many cases, diabetes can come back, which is why it is so important to continue your diabetes appointments while in remission. The programme consists of 3 phases. You will have weekly appointments initially, and as you move through the programme, your appointments will be spaced out. The next slides will tell you more about the different phases. Phase 1. This is a 12-week diet called the Total Diet Replacement. During this phase, you will be using meal replacement products provided for you by ABL Health. The products will be shakes or soups to give you between 800 to 900 calories per day. Generally, you will have 4 meal replacement products per day. You will be monitored by the nutritionist on a weekly basis, and attendance at these appointments is very important. People tell us that the first few days can be hard during this phase, although if you stick with it, it does become easier, and for some, easier than they anticipated. Some symptoms you may experience during this phase include constipation, dizziness, and headaches. These side effects often go away after a while, and your nutritionist will be there to support you and provide you with the tools to overcome obstacles and side effects. You will have a choice of 6 products that you can order online: chicken and vegetable soup, chocolate, banana, strawberry, and vanilla milkshakes. When you get invited to your initial assessment, you will get a code to order your starter pack. This will give you an idea of how the products taste, so you can decide if you feel you could cope for 12 weeks on these products alone. Some feedback is that people get tired of the taste. However, we do have some guidance to help you through this phase. Take note that all the products are based on milk protein and contain soya. If you are allergic to milk or lactose, this may not be suitable for you. The symptoms disappear after 4 to 6 days, and people often tell us that they find this phase relatively easy after that. Many people feel less hungry, and they are quite surprised by this. People also seem to be more focused and have more energy during this phase. Ensuring you talk to your family and friends about the program can be helpful in social events and day-to-day living. Phase 2. Reintroduction. During this stage, you will be supported by the nutritionist to introduce a healthy, balanced diet, whilst gradually withdrawing the meal replacement products. By doing this, you will gradually start eating, making the transition easier and controlled to ensure further weight loss if needed. You will be seen every 2 weeks by your nutritionist. Phase 3. Maintenance. Supporting maintenance. The last phase is the maintenance phase, where we work with you towards lifelong and sustainable changes. During this phase of the program, we will provide you with the knowledge and tools you need to continue to achieve your health and well-being goals, and hopefully put your type 2 diabetes into remission. With the additional support of the Your Health Your Way service in Nottinghamshire, we will support you to make physical activity part of your daily routine and habits going forward. The most common side effects reported are constipation, sensitivity to cold, headaches, dizziness, and fatigue. These are more likely to happen during the first phase. You may also experience very rare side effects. It is important to let your nutritionist know if you have any of these side effects, or contact your own GP if you are in pain. These side effects only happen in a small number of people, but can be serious, so immediate attention is required. This includes severe tummy aches, which may be gallstones, pancreatitis, or kidney issues. Gout flare-ups are also possible and need treatment from your GP. During the program, your GP may need to change the medication you take to treat your blood pressure and blood glucose levels. Some medications may be stopped altogether when you start on the first day of the total diet replacement phase. If you leave the program unexpectedly, you must inform your GP, as some medication may need to be added back to your prescription list. We want to reassure you that slip-ups are part of everyday life. During the program, we have a relapse protocol that will get you back on track. Throughout the program, we will support you to identify triggers that may cause a relapse and develop the skills to manage relapse yourself. The relapse protocol will start if you gain more than 2 kilograms from phase 2 in the program, and involves going back on the total meal replacement products for 4 weeks with weekly support sessions. Despite reaching remission of your diabetes, you will still need to attend your yearly diabetes check so that your GP can monitor the health of your eyes during your retinal screening and your feet and kidney function. They will also check your blood glucose level to see if your treatment is still appropriate. You can stay in touch with the Your Health Your Way team and even enroll in additional sessions for physical activity and weight management. We also offer stop smoking services and alcohol reduction support. Your next steps might be to do some further reading. The Diabetes UK website offers more details and has links to read the research behind the low-calorie diet program. If you feel this is the right program for you, you can contact your GP to discuss a referral. It is important to have realistic expectations and be aware of the challenges you may face during the program. If it is right for you and the right time is now, make a start.